Welcome to this webisode of Roche's virtual international experience exchange for patient organizations. With IEPO 2020 having gone fully virtual, we have turned the content of what would have been discussed in Berlin this year into exciting virtual formats. Webisodes like this one have replaced the 6 original learning labs. They feature members of the IEPO community and are available for viewing or download on iepo.com. And they contain discussion questions and links to related resources, such as posters submitted by patient organizations from around the world. So today I am happy to welcome Ellen Huff-Davies and Kawaldeep Semi, who will be discussing the topic of health monitoring in the age of connectedness. The focus of the conversation will be on the impact of health data generation in patient care. They will be discussing different ways data is generated and examine the value of different kinds of data, as well as the ethical implications of health monitoring. Let me start with a few words about our speakers, and you can find their full bios on iepo.com. Ellen is the CEO of Appareto, a digital health company focused on developing patient-centric digital outcomes to support centralized trials. She also serves as chair of the board of trustees for Metabolic Support UK, a patient advocacy group supporting 400 rare metabolic diseases. Kawaldeep is the CEO of the International Alliance of Patient Organizations, a global alliance representing patients of all nations, all disease areas, and promoting patient-centered healthcare.
Thank you for the opportunity to join you today. 2 of the major trends impacting us today is patient-centricity and patient empowerment, and actually the role of the patient in moving this aspect forward is colliding, if you like, in terms of what the digital capabilities are. So I like to refer to this as the perfect storm. The patients are becoming more empowered. They're able to direct more and more what they would like as part of their care or need as part of their care. And at the same time, we're having the digital and innovation capabilities that make this happen. And indeed, it's the same digital innovation capabilities that they're using in their every other day-to-day life. But it's now also becoming available for healthcare. And I think that combination of those 2 things, as I say, is creating a perfect storm to propel this forward and to support patient care better. I think one of the other aspects is the data and our ability now to process far more quantity of data to provide meaningful insights in real time. And I think from a patient's perspective, that's also what they are leaning towards having. And I don't know, Khalid, from your point of view, if that's what you're hearing from the communities as well.
I think yes. From our point, the most important aspect is that much of what's being generated is generated in real time, and that it's a two-way process of exchange between the patient and the healthcare professionals is also within their control. So much of the digital devices that they're wearing and the actual real-time sort of devices that you attach on, they're yielding a lot of personal information at that real time and in real moment. And therefore, you can control what's being used and said and how you exchange it. And I think this is where we see the same trends, that it's patient empowerment, which Ellen has talked about, and it's also real-time data that's exchanged in real time, giving you an accurate position. Years ago, very often what would happen is some kind of symptom would appear in the patient, and you would have to wait the next morning to turn up at the surgery. And by the time you turned up at the surgery, the symptom would have gone. It wouldn't be there. There's no sign or trace of it. So the diagnosis couldn't be made. Whereas here, if there's something happening, the wearable device you have would immediately pick up that change and also relay even your video that you might be able to send over to show where the rash is, what kind of rash is. That adds to the diagnosis, and that diagnosis can be accurate.
I think as a society, as citizens today, we have got quite used to having instant feedback, so as an example, when we go on Google now, if our Wi-Fi connection is only a few seconds slower than usual, we get impatient. We need to have that sort of insight. We need to have that two-way communication, and we want to get information quicker and more responsive than we have historically. Sometimes it's not always a good thing to be a generation of instant gratification and always wanting data. But I think that sort of way of living is transcending that. They're expecting this the same in the healthcare, and providing endless symptoms and signs and reporting to a vacuum of a paper-based electronic health records is no longer enough for patients, and they want to have the data back, and they want to have insights from it, and they want that, as you say, in real time and very quickly, so they can respond to it.
And just to highlight on the concept of that empowerment and control. For instance, if the patient is unhappy with something, with a treatment being offered or some other issue, they can switch the device off. That shows that they're in charge of this device and the data it shares. They just turn it off. And I think that empowerment brings responsibility as well. But it gives you the kind of level of interaction and patient involvement you need. And for remote teams, when they're sitting somewhere across the country, maybe across 2 or 3 time zones away as well, it makes perfect sense to have a conversation with the patient and ask them to turn out whatever device they have and report on it. So that level of exchange is very important for us. That shows we are being included within the decision and that we have a control to your data.
I think that word control is really important, and I think that's where healthcare today is changing. Historically, you could have argued that there was an unbalanced control. The doctor had all the knowledge. We had to wait patiently for our time to be seen by the doctor. We had to rely on the knowledge source that the doctor and the healthcare professionals had. And now this element of control is changing. And, I still strongly feel that, the role of the doctor in person will forever be critical. But it's balancing more about the control of what's important to me, and changing the dynamic slightly for the patient-doctor relationship, but in a way that makes that control level a bit more balanced and helpful for the patient on a day-to-day basis, I think.
I think that interaction, as you said, is now being worked out. I think this is something with the world post-COVID. We suddenly saw a lot of digital services turn up, a lot of data being exchanged. There were people being delivered oxygen meters and so forth in the home. The diabetic real-time glucose meters were being connected up to Wi-Fi, data being exchanged. And all this is being worked out. I think it's a work in progress. And this is why we encourage more openness at this time. Don't shut the gates quickly, because we need to keep them open.
So, Ellen, Kawaldeep, do either of you have real-life examples you would like to share?
So I think in terms of actual tangible examples today, we have some really exciting ones. There is a wearable device that's been qualified by the European Medicine Agency for measuring stride velocity in Duchenne muscular dystrophy. And I think that's quite a significant leap forward in terms of the regulatory buy-in into this real-time, or I should say continuous real-world data from a wearable. On another level, we have some really exciting voice-based data capture that can pick up, depression and other illness based on sort of your breathing, and some COVID-related symptoms, even from breathlessness from your voice and a couple of sentences. And then a project that we're involved with at Apparito, which is really one of many exciting ones that we're doing at the moment, is video-based assessment. So one is in Sanfilippo disease, which is an incredibly difficult disease to monitor because it's in children, and these children are are experiencing dementia-like symptoms. So the hospital-based neurocognitive assessments really don't convey what the patients live with on a day-to-day basis. And so that's been where we combine some standardized video-based assessments to convey those symptoms or aspects of day-to-day life and disease hallmarks in a standardized video capture.
Yes, I think Ellen just mentioned the most exciting part of these. That's artificial intelligence and machine learning. I think this is where we are finding as patients is that the application of apps in rare conditions is even more critical now. Traditional medicine has always ignored rare diseases and gone for the big solutions, with large volumes of medicines, large this, large that. But with apps, using what is termed as a theoretical, the long tail, you have small groups who will benefit from these apps because they mean something to them in their life. And at the same time, I think Ellen has mentioned very clearly that these apps have to make the understanding global across the health system, and they help us remove some of the silos. I think this data really brings in all the team.
Yeah, that's definitely the aspiration, to do that in a way that's helpful to the patient and the full team of healthcare professionals, regardless of whether they're local or experts globally, for sure.
And I think it's more acceptable as well. I think, for instance, if you have a traditional treatment and you do something different to it, you have to go back to the patient, and there's a lot of negotiation going. But with the apps, the added beauty is that we're already used to this with our software.
Yeah.
All you do is app physical fitness 2.0, or 2.1, and that's acceptable because we understand that's an improvement. So this is the beauty of apps, that they can be 2.0, 2.z, 2.infinity kind of numbers, any numbers, and they will accept these improvements as part and parcel of this.
Absolutely.
So over to you now. Referring to all that we have discussed before, what types of health monitoring and data sharing do you currently feel comfortable with?
One of the most important aspects of sharing data and also making sure we participate in data sharing is that patients feel comfortable with certain things. I think the kind of health monitoring we are really comfortable with is the one that comes up with cast iron guarantees that this data will not be shared without our permission. This data cannot be accessed. This data cannot be to our disadvantage, that this data is kept within that confinement of health professional-patient relationship. And very often what used to happen is that your general practitioner knew more about you because you shared with them than your family did. And that data remained in his head. It was always there, but he never shared it with anybody else. But now with some of these apps who are generating, that are really churning out information about us, we would feel comfortable if there's some secure protocols, software data protection protocols in place, and all the people involved make sure this happens. As you know, at the moment there is certain doubt as to what has happened with some of these COVID. This shouldn't happen. Patients as a whole are happy to share all parts of their lives, provided these are secure and we are given cast iron guarantees that nothing untoward happens with this and that we are not placed at a disadvantage. It's a win-win for us to reassure them. We must bring in that trust. Ellen, I don't know how you feel about this.
Yeah, I mean, I completely agree. I guess with my role as, the chair for Metabolic Support UK, we cover we support around 4 different inherited metabolic disorders. And the type of data that each individual patient group or patient community would be, able and willing to share, obviously quite individual to that community. Yeah. But as you say, what transforms across across all of it, it's not necessarily the type of data that you're willing to share, but it's this guarantee that it's maintaining privacy and protecting your own data integrity, and that circle of trust means that that's only used for the purpose that data was intended to be shared.
Let's move now to discuss what we do with all this health data. Also, does all data have the same value?
I think, how we convey the value from the data essentially goes down, in my view, to the context of use. So there are so many different ways we could utilize this data, from diagnostics purposes, for prognostic purposes, for monitoring purposes. And so I think we have to start with the patients sort of guiding us in this co-creation of how do we use the data and what the data is used for. So, aggregating data for diagnostic purposes versus aggregating data for prognostics purposes, and then obviously continuous real-time monitoring, that you can have tangible insight and tangible actionable things that you as a patient can do based on the data, I think is something really important to consider.
I think from the patient's perspective, I think what really concerns us is to make sure that we value that data that brings immediate changes, meaning that does this data quickly result in improving patient safety in a health system? Does this data improve the quality of the treatment? Does this data go forward and make sure access is improved to this health service? They're able to design better solutions, better patient-centric availability solutions. And also, does this data in the long run improve health systems, make sure that they can deliver more of these services to us at an affordable cost? So I think one of the biggest bug points of our patient groups is that why are you gathering this data? Is this data just for you to publish papers and exchange papers, turn up at conferences and deliver these papers and then forget all about us? Or is this data being generated, captured, so that you improve something for us, so that in the long term, if it doesn't benefit my health, but at least it benefits other patients to come? That's why we actually enter into research programs, clinical trials, that we are trying to improve not only our own personal lives, but lives of others.
So could you comment on what digital biomarkers could convey disease impact?
So I think biomarker as a word has become, hugely popular in terms of, a biomarker for prognostic, diagnostic, response to therapy. We have to look at biomarker in the way that we do use it in terms of other clinical aspects before we then bring in the concept of digital biomarker and sort of, what that's intended for. But from my point of view, I think, movement and voice are two really exciting biomarkers that we could convey to really simple but very effective biomarkers.
Yes. I think I would go much deeper in that some of the biomarkers we even don't understand or haven't discovered them. So by use of AI and machine learning, I think new biomarkers would be found out. I think this is the beauty of digital healthcare, that with multifactorial situations, you might find that some of the most critical biomarkers, which we haven't even identified yet, may come up or may surface during the AI and machine learning period. And we would like to have those in there, meaning that let's have it open-ended, that we don't get caught up with just one or two biomarkers.
So over to you now. What kinds of health data do you feel is most important for improving patient care, and what digital biomarkers could convey disease impact?
This topic of what type of healthcare data is sort of most important is not actually one that we can necessarily generalize across the board. We have to start by what's important for that individual patient, but also for that patient community and that disease. So, what if we're really aspiring to what we call personalized medicine or precision medicine, you have to consider what's important to me, and it might be quite different to what's important to you. And therefore, the type of data that we convey and put value on has to relate back to what's important to me in the way that I have to deal with my disease on a day-to-day basis.
Yes. I entirely agree. I think Ellen has brought us a very important point that really, for us, we would like to move away from that granular picture that's being given at the moment in what is called generalized and apps, etc. We would like to see this fine-tune, bring fine focus and clarity, what I tolerate and what the disease in me is doing, because I might be at the earlier stages or mid stages or late stages of the disease. Similarly, the level of tolerance to certain treatments or drug A might work better on me than B or combination.
The issue of data privacy and Big Brother is one of critical importance to the patient community. Can either of you comment on this?
Yes. I think one of the biggest concerns that the patient community has is that some of the agencies that can access this data. As you know, we are already very sensitive about health data, who owns it and who accesses it and how we share it, because nobody would like to portray their vulnerabilities. And some of these conditions may have implications not only on the patient themselves, but generations to come, especially in genetic disorders. Now, there are certain other conditions that you know very well with HIV, AIDS, and others, that there are certain governments which have got some very draconian and medieval approaches to the disease. They punish the patient, not the disease, as I say, and therefore we would like to make sure that this does not happen. The way this is being done right now is that we are coming up with apps without shutting the back doors. We are hosting them on places which have never been looked at, the security principle. And all you need is one leak and everybody then shrinks away. Nobody wants to use things. I think I enjoyed the WHO Director General's excellent speech that this is the time for national unity and global solidarity. And it means whole of government, whole of society, and whole of patient movement working with this digital health solution and making sure that we do not have this kind of mistrust generated. If we want this to succeed, then Big Brother shouldn't even appear in our horizon.
Yeah, no, absolutely. I think right at the beginning of this conversation, we were talking about, the perfect storm between patient empowerment and digital innovation, making it possible. I think at the same time, we have to be mindful that we're probably having what essentially could be a culture clash between sort of the ethics that the medical communities used to work in and the working principles that the tech giant seems to be operating in. I think we potentially have quite a colliding sense of principles, a colliding sense of ethics. And if we're truly going to make digital health work and really adopt these innovations and technology, we have to make sure that they are adopted under the umbrella of medical ethics, of do no harm, and justice, and all that kind of principles that's embedded in medicine and healthcare.
So this webisode is called Health Monitoring in the Age of Connectedness. Where do you think we will be 5 years from now?
So when I consider health monitoring in the age of connectedness, what I want to do is make sure that digital innovation bring us closer together as people. So connectedness to me means human to human interaction and patient to clinician or patient to other patients. So, the ideal scenario is that digital solutions, innovation bring this connectedness on a human level together. And let's not use this word connectedness just to mean devices or digital or technology, but let's use this word connectedness to mean better relationships with your healthcare professionals, and better peer-to-peer support for other patients living in the same scenario.
5 years from now, I want to make sure that we have my devices, my preventative teams, public health programs, all connected so well personally to me that they pick out my disease even before it happens. In other words, I don't become a patient. That's what I'm looking at. So then 5 years from now, we actually do that proactive work. We make sure nobody falls ill and we don't need that acute care. In other words, things trigger so quickly, you basically get an SMS message, just like now we're doing test and track, which says, Carl, you know what, you're at high risk. Now we feel you should drop in and have a chat to us so that we can correct this now rather than later. That's what I'd like to see. That's interconnectivity, and that's what I'm looking for.
On behalf of the Roche Global Patient Partnership Team and the EPO External Advisory Committee, thank you very much for being with us today. I'd like to thank our speakers, Ellen and Kawaldeep, for the time in unpacking this exciting topic of health monitoring in the era of connectedness, covering everything from the impact of health data generation and patient care to the ethical implications of health monitoring. It's a wide-ranging topic that I am sure will spark further discussions. And if you're interested in using this webisode to inspire your own conversations, you can visit ayepo.com for more information and also to download the related e-posters. Thank you very much.